Hello, and welcome to the second AANA Town Hall COVID-19 update. I'm Kate Jansky, President of the AANA. On behalf of myself and the AANA Board of Directors, I'd like to thank you for your efforts to combat the COVID-19 crisis. This is an unprecedented time, and I am proud of all the work that our members are doing to help address the healthcare crisis that our nation is facing. In the past few weeks, you've seen a lot of communication from the AANA about recent developments on the state, federal, and national level related to COVID-19. I can assure you that the AANA Board of Directors and staff have been all hands on deck on this issue. We've been working diligently on all fronts, providing practice resources to address issues that our members are dealing with on the front lines, battling COVID-19 outbreak, advocating for you in Congress, at the White House, the Veterans Administration, and providing support and advocacy resources at the state and local levels. Tonight, we'll discuss the latest issues and development related to the practice and advocacy. We plan to highlight the most frequently asked questions and issues that you're facing during these critical times. I'll now turn it over to Dr. Jordan, Chief Advocacy Officer, who will serve as our moderator. Lorraine?
Well, good evening. As Kate's already described, we hope to bring you up to date with some of the activities AANA has been involved with as it relates to COVID-19 and impacting CRNAs. And to start the town hall meeting off, I'm going to ask AANA CEO, Dr. Randall Moore, to present his perspective. So Randy, can you provide for us your perspective on the current status of the COVID-19 crisis and what we should be expecting in the coming days and weeks ahead?
Yeah, thanks, Lorraine. So it's clear. Let's do a status update in terms of what we're seeing in three major buckets, and then we'll go into that in just a little bit more detail. So first, it's really important at the macro level to understand how the COVID-19 crisis is impacting the economy of this country, right? So we know in a matter of 6 weeks, there's 26 million Americans who've been put out of work, which is, an unbelievable statistic that, 6 weeks, 26 million people are now out of work. Just this morning, some new data came out and indicated that the gross domestic product of this country shrunk by almost 5% in Q1, quarter one. The truth of the matter is that that number is misleading because it's probably more likely in the 30% range because that only captures just a couple weeks of that quarter, right? So the impact of COVID impacts only just a couple weeks of that quarter. So it's quite likely in the spring, later on, we're going to see some numbers which would indicate that the GDP of this country has shrunk 30% as a result of COVID-19. It's also important to understand how the government is trying to respond to this. We know that in the matter of 5 or 6 weeks, we've seen $3 trillion, with a T, $trillion worth of stimulus coming out of the federal government, primarily through CARES Act. It's quite likely in the May timeframe, we'll see some more stimulus coming from the federal government. When you look at the economic impact this is having on this country, it's really important also to factor in the equation the impact it's having on individual states, right? So we know there are several states and a growing number that are experiencing significant financial strain. Now, some of those states like Illinois, that's where I'm from, was in bad financial position before COVID-19. And then you add on the impact of COVID-19, and the state of Illinois is circling the drain financially, and there's several other states in the same boat. So what that means for us is we need to be prepared for and cognizant of the likelihood that states are going to start embarking on some draconian expense control measures. That means slashing the budgets on the expense side. And that will be in the form of people, jobs, programs, potentially Medicaid and other programs that will be adversely impacted in the coming weeks and months because of the financial status of those states. Clearly, we're seeing intense market volatility. We think that that's going to be persistent for some time now. If you've been watching your 401k, certainly you've seen the impact. We think it's going to be several weeks, months before we're going to see any kind of recovery. And we think that recovery is going to be slow and arduous. And so that's important to understand too, when you're looking at this from the 100,000 foot level. And then you look what's happening to healthcare, right? So healthcare providers and healthcare organizations have been severely impacted, primarily because, I mean, it's a double cut, right? So we're seeing a significant decline in revenue, up to 75% in many facilities because of the stoppage of elective surgeries. And then you have many facilities who are shouldering the burden of COVID-19 care. So it's really important to watch how this is going to play out. Many of these hospitals, particularly in rural America, are already circling the drain financially, very thin margins. Many of them are already in the red. So what we think is we're going to see, and we're already seeing it now, but we're going to see an increase in hospital failures, and hospital closures in the coming weeks and days as a result of COVID-19. And then, of course, the impact on the members, right? We've already reported out some pretty startling data, which indicates somewhere on the order of 50%, and that's conservative, 50% of nurse anesthetists have been adversely impacted from an employment perspective, right? They've had their hours cut, they've been furloughed, they've been terminated. So, major impact there.
So Randy, so that's really a great overview, but I'm curious, what are the AANA's priorities as it relates to COVID-19, and how are we implementing those?
So we'll dig into that a little bit more detail with a future or with panelists coming up. I would say, the huge focus right now still remains on the inadequate supply of personal protective equipment for our members and for other healthcare providers. Just recently, I had the opportunity to speak to a member who related a story that I think many of you are familiar with, which is she does not have the adequate amount and kind of personal protective equipment she needs to protect herself. In fact, she's walking around with the same N95 mask, which was handed out to her a month ago. And she's not alone, right? There's all kinds of CRNAs who are in the same boat. So we continue to focus an enormous amount of our time and our energy and our influence with the White House and with federal agencies to ensure that insufficient supply of PPE is addressed. We're also working on, and we'll discuss this a little bit later on, is additional financial protections for CRNAs through legislation and removal of barriers at the state and national level. And finally, we're really putting a lot of time and energy into, we know and we're seeing, obviously, parts of the country starting to open up, and we're seeing elective procedures, which were stopped, starting to resume in certain states, in certain areas of states. And so we're providing guidance to our members about, well, how do you do that? How do you do that safely? What patients are appropriate? What patients are inappropriate? What level of testing is required? All of those questions need to be answered, and we're providing those resources for our members.
So this kind of ties into, and I want you to illuminate a little bit farther, as the country begins to reopen and reopen on elective surgeries and many other places. What are you expecting, and what are you looking forward to see in the future as it relates to and impacting CRNAs in the healthcare system as a whole?
Well, we're currently in the process of a very interesting and high-risk experiment. If you look at, I'll throw Georgia out as an example, where Georgia is opening up this week, right? They're opening up, and we're going to see what the implications of that are. Right, the federal government and federal agencies have put out guidance and says these are the criteria you need to satisfy before you can safely begin to reopen. Georgia has not met any of those criteria, and Georgia's not alone. There's other states, particularly in the Southeast, who are opening up. So we're going to see what the implications of that are. Right, we know based on the work that we're doing and the guidance that we are seeing from other agencies, from agencies and from the federal government, there's really three things that need to be satisfied in order to safely open up, right? When I say open up, we're talking about non-essential work, we're talking about even elective surgeries. One is you need testing. You need robust testing. And at this point in time, based on what I'm reading and seeing, there's not an adequate supply of testing right now to open up any state fully. The second piece of that is contact tracing, right? So if it's really important to know if someone tests positive COVID-19, how they acquired the disease and who they've exposed subsequent to that. That is not fully in place either. And then the third piece is around resources, right? Do we have personal protective equipment? Do we have the ventilators? Do we have the ICU beds? Do we have the providers? And this includes nursing homes, some of which are being decimated by COVID-19. So we're going to see here in the coming weeks what will happen with Georgia and other states and how that will impact the course of this crisis. Will some people characterize it as premature opening of these states prolong the financial pain? Will it prolong the public health pain that we're feeling, meaning more patients getting sick at higher mortality? All of those things are going to be playing out in the coming weeks, and we should be very, very in tune to all of that.
Thank you so much, Randy, for taking some time to address the overall issue of COVID and AANA's involvement. We truly appreciate everything that you do. Well, let's go to practice. So Dr. Bret Morgan, AANA Senior Director of Practice and Education, we've got him on the line this evening. And I'd like to ask you, or think about this, and see what you think. We've gotten some responses from our members, and our members have asked, my facility is to still experience a significant lack of PPE. What recommendations can you make for reusing PPE, like N95 masks? Bret?
Lorraine, that's a great question, and it's actually one that we're starting to receive quite often. Randy mentioned a few moments ago that members are reporting having to reuse their same PPE, particularly N95 masks, over and over again. And so I want to draw attention to the fact that the AANA Journal just actually today published an article that you can find on the AANA Journal app that actually starts to address this very issue. While there really is not a whole lot of evidence to support the reuse of PPE, particularly since it wasn't initially designed to be reused, things like N95 masks, some studies have been conducted and are being conducted that offer us some options. And healthcare organizations across the country have started to use techniques within their own facilities. So we have some lessons learned from them as well. When deciding on a decontamination method, though, it's not only important to consider their effectiveness, but also what's the scalability of that approach, because not every facility is going to have specialized equipment that's necessary to, or the processes in place that's going to be necessary to reuse PPE. Some of the most common effective methods that we've been able to identify in the literature and we're seeing in clinical practice are, vaporized hydrogen peroxide, warm moist heat, and one of the more popular options is ultraviolet germicidal irradiation. That being said, all three of these methods actually do weaken PPE, in particular N95 masks, at a rate that we don't fully understand. So the literature isn't necessarily clear yet on what the long-term effect of reusing or decontaminating PPE is going to be. I'd like to suggest, though, that CRNAs read this newly published article to better understand what evidence is out there related to PPE decontamination. And also, I'm going to ask everybody to share their experiences with us, because we're actually learning a lot from each other right now. And we can share your experiences and your wins with our other members.
Bret, thank you so much. Another question, what recommendations do you have regarding resuming elective surgeries?
First off, I want to say that it's great news that we're starting to have this conversation. I think that for many reasons, our members are excited to see elective surgeries beginning across our country. And we're also hearing that many of our members are being involved in conversations about how to resume elective procedures in their facilities, and that's also great news. That being said, I do have some recommendations that I would like for CRNAs to consider when your facility is considering resuming elective or non-essential cases. First of all, it's critical that you know your community's coronavirus statistics. and also the availability of testing within your facility and your community. As Randy mentioned earlier, testing is going to be essential in safely reopening our communities. You need to have an adequate and probably more important, a reliable supply of proper PPE. We cannot assume that we can resume elective procedures the same way that we did prior to this pandemic. And so it's going to be essential that you have the right equipment and PPE. Healthcare facilities and supporting community facilities must have the capacity to handle an increase in COVID cases. And I think that's another thing that we're not sure how reopening our communities is going to impact us in a couple weeks. What percentage of available ventilators do you have within your community facilities? And are you going to be able to handle if we have a resurgence or if you have a resurgence? Staffing must be able to support reopening. And this includes a need for alternative or staggered scheduling, because it's important that we consider the fundamental social distancing properties here, and that's going to include staffing. And then again, even in a facility, social distancing throughout the surgical experience must be able to be maintained. And this could include using things like telehealth for pre-oping patients, or limiting or excluding visitors from participating. And the facility plan should be developed to address COVID considerations across all phases of surgery, not just the intraoperative phase. Also, with all this in mind, I strongly feel that no frontline worker should be forced to return to work until they're comfortable with the environment that they're being asked to work in. All frontline healthcare providers should receive recognition for their contribution and an increase in compensation due to their risk of exposure. And removal of scope of practice barriers within facilities, state and federal, and at the state and federal level should be made permanent to allow for us to adequately assume the roles we're going to need to assume as we start to do surgery again. Also, for more information on our recommendations and other recommendations, I would recommend that you visit the AANA's COVID site, because we have resources there on this very topic.
So Brett, here's another question we're starting to see more and more. My facility mostly does MAC cases. Should I consider these high-risk cases during this time?
Lorraine, this is a really complex question. I wish the answer was yes or no, but I think considering the clinical environment that we're in right now, first and foremost, it is still very prudent to consider the risk associated with pre-symptomatic and asymptomatic patients. And then consider the likelihood of aerosolization as it results from the procedure that's being conducted. For instance, upper endoscopy procedures carry a very high risk of aerosolization as compared to other MAC cases, where the risk might be very low. So recognizing that there are challenges with PPE supply, this is a real consideration to take into account. It's also important to consider the prevalence of COVID-19 in your community. Also, in some cases where the likelihood of aerosolization is low and there's good testing available and the community prevalence is low, airborne precautions might not be necessary. MAC cases, I do want to remind everybody, do have some advantages, and we're starting to see recommendations come out for how we can handle the backlog of surgical cases that we're going to have to deal with for the next probably year or more. And MAC cases do have some advantages as compared to those that require general anesthesia. For instance, phase 1 recovery can often be bypassed, allowing patients to spend less time in the whole perioperative setting, which is an advantage. As we begin to see more of these recommendations be made on resuming surgical procedures, I predict that we're going to be developing more specific guidelines for MAC cases. So stay tuned.
So Brett, here's a hot potato. About half of the CRNAs in this country are going to be faced with this, or maybe pondering this question. So I'm going to ask you. This year's my year to be recertified, and I'm concerned that I'm not going to be able to get enough CEs. Some of our members feel that all the conferences that have been planned have been canceled. So what's AANA doing to help us out?
Well, we've heard this concern from many of our members, and I think there are probably some of the CRNAs on staff are in the same situation. So we are committed to providing high quality, relevant CE for our members. And I'm excited to share with our members that we are now offering free access to our new CE platform, CRNA Knowledge Network, until the end of July. The CRNA Knowledge Network is our innovative, what we refer to as our Netflix-style CE portal, with topics across our profession, from clinical topics, pain management, the business of anesthesia, wellness, and of course, our new COVID-19 content. Also, the ANA professional development team has been very busy during this time, bringing us clinical and policy experts and bringing them directly to you. Our recent webinars on ARDS, infection control, wellness, and the impending drug shortage have attracted thousands of participants. In the coming weeks, we have several more planned, including one next week on considerations for pediatric patients during the COVID pandemic. In addition, the advocacy team has been working hard to share tools for improving state advocacy and how to handle workforce crises. So all these webinars and town halls that we've been offering are completely free and are being offered for continuing education credit, Class A, and can be found and viewed on our webpage. So for more information on the CKN, or the CRNA Knowledge Network, and our webinar series, please visit our website, or you can reach out to us and we'd be happy to direct you to those resources.
Bret, thank you so much for taking the time to inform us. Now, I'd like to go ahead and ask Aana Poliak to participate with us, and I have some questions for you, Aana. How long can we expect to see the CRNA workforce affected by prohibitions on elective surgeries?
Hi, Lorraine. I think both Bret and Randy kind of touched on this question, so I'll approach it from a different angle and talk about it from the angle of us tracking the information that's coming from the states on this issue. So right now, we're aware of 12 states that are beginning to roll back prohibitions on elective surgeries. And a recent Becker's article indicated there may be as many as 19 states that are resuming elective procedures with varying conditions that might need to be met, for the elective surgeries to resume. In general, these states are not giving blanket approval on procedures, but rather setting up steps, considerations, and timelines in order to begin doing elective surgeries again. Initially, we were aware of 37 states that put prohibitions on elective procedures in the first place. So having 19 states, roll back the prohibitions, that's pretty significant. We are seeing more and more states do this literally every day, and we keep this information updated on our SGA COVID-19 page. So if you're curious to find out what's going on in your state, we have most up-to-date information there. So also keep in mind that states are resuming elective procedures in steps, so it may take some time for it to take into effect. And individual facilities may also choose to not proceed with elective procedures depending on their own decision making and the type of patients they're treating and their overall capacity. But there's generally a strong trend towards resumption of most elective procedures in the near future. Again, if you have questions about what's going on in your state specifically, please visit our SGA COVID-19 page, and we should have most up-to-date information available to us there.
I have heard that states are offering liability protection to healthcare workers during the COVID-19 crisis. Should I feel safe making changes to how I practice?
It's a good question, Lorraine, and we've been monitoring the situation and trying to see what comes out of states in terms of this guidance. The first thing that everyone needs to keep in mind that this only pertains to COVID-related care. And yes, we've seen some states introduce a guidance that does offer liability protection for healthcare workers taking care of COVID-19 patients. While a number of CRNAs are working in the front lines taking care of COVID-19 patients, there's still a number of CRNAs providing regular anesthesia, whether it be for OB or cases that are not elective cases. So those protections would not be applicable to these providers. At this time, we're worried about a dozen states that have rolled out some sort of liability protection for healthcare workers related to COVID-19 treatment. It should be noted that these protections do not, these protections exempt gross negligence or willful conduct. So essentially, if you're on the front line taking care of COVID-19 patients, but your conduct constitutes gross negligence or willful misconduct, the protections will not apply. Also, we need to keep in mind that terms gross negligence or willful misconduct don't have clear definitions. So determining, what actions fall into these categories usually comes down to court's interpretation of the specific facts and circumstances in a given case, and may also be based on the case law in the given jurisdiction. So therefore, essentially only minority states have created true protections, and these protections are not guaranteed. So for the CRNAs who are on the front lines, working with COVID-19 patients, you should continue doing what you've always been doing to protect yourself from exposure to liability. But that being said, it's good to see that states are acknowledging the risks that COVID-19 providers are facing in terms of liability and creating additional protections for those healthcare providers who are taking care of COVID-19 patients.
So Anna, what's AANA doing to make the temporary state suspension of supervision and other barriers permanently removed, actually?
Yeah, we're doing a lot. This is a crisis situation that nobody planned for, but it did put CRNAs on the front line. It really emphasized the roles that CRNAs play in the healthcare system and the value that CRNAs bring to the table. So with the advocacy perspective, this is an opportunity for us. While many legislatures have adjourned early due to COVID-19 situation, I think when states are back in business, we'll have great opportunity to bring our issues to the lawmakers. We're currently working with leaders in a number of states to determine opportunities, to remove barriers to CRNA practice. And this includes everything from prescriptive authority to supervision to other restrictive elements of physician involvement. So, there's a great opportunity for CRNA profession to make some of these temporary waivers of restrictions to their practice permanent. That being said, I want to spend just a minute and talk about how does that work. We've been getting a lot of calls and questions from members and state leaders. How do you make these temporary removals permanent? When the governor removes, say, supervision language or prescriptive authority or other restrictive scope of practice limits, it's in the time of crisis is done by an executive order. Because emergency exists in a given state. Governor is considered to be the head of the executive branch in any state, and hence he cannot change the law permanently. That would need to be done through the state legislature, which is the legislative branch. So while it would be great if we can contact any given governor and say, Governor, you remove these restrictions during the time of COVID-19 crisis, can you please make it permanent? The governors do not have this authority. And, while it sounds kind of unfortunate, for this specific situation, it's probably a good thing. Any state has an executive branch, a legislative branch, and a judiciary branch. And, it is essential to our democracy. So in order for us to make these changes permanent, we need to go through the same process that we would normally go through if we wanted to introduce legislation in a state and remove barriers. So for instance, if we want to remove supervision that's currently in state Nurse Practice Act, we would need to introduce legislation and remove that particular barrier. If we want to introduce something that's currently in the nursing rules, we would need to work with the Board of Nursing and go through the rulemaking process. So those are the steps that would need to be taken to make these temporary changes permanent. That being said, I think we have a great message to communicate to decision makers as a result of the COVID-19 situation. When there was a crisis, CRNA stepped up to the challenge. They were on the front lines, intubating patients, taking care of COVID-19 patients. And it's interesting because so many governors recognize the importance of CRNA contribution to the pandemic and remove these barriers very, very quickly. We've had 12 states that have specifically 14 states actually that have specifically removed barriers for CRNAs and, removed supervision, removed restricted physician presence. So that was a huge sign that our policymakers do recognize what CRNAs bring to the table. So, when the situation balances out and states are back in business, we'll have good stories to tell. We have CRNAs that have been in the news on the front lines. And, while CRNAs were able to step up and be a solution to the emergency acute crisis, there's going to be a long-term crisis in our healthcare system post-COVID-19, as Randy and, Bret alluded to. There'll be a backlog of surgeries. All of that would need to be dealt with. And I think we have great opportunity to tell lawmakers that they need to remove these barriers so CRNAs can take care of patients and really be a solution to the crisis that our healthcare system will be facing post-COVID-19. So to answer your question, we're working with the states, a lot of good opportunities for CRNAs, and we're very excited about it.
Thank you, Anna, and thanks to your team for all the hard work that you're doing to help our states. So Ralph, there's probably nothing happening in DC, is there? At least nothing that we know of, right? So why don't you give us an update on the latest advocacy efforts related to COVID-19 as it relates to what you're seeing in Washington, DC?
Absolutely. Thank you, Lorraine. There's quite a bit going on here in DC, and we are doing our best to remain front and center in those conversations. We are working actively with members of Congress, the administration, and other interested stakeholders to advance our priorities in the next COVID package. And Randy alluded to it, it's under works now currently. Hill staff are working hard, pulling together the package, and we can expect them to ramp up in the next couple weeks. So we are doing our due diligence to make sure that we are having the conversations with the policymakers that are going to be shaping the next COVID package. And we're laser focused on kind of three major buckets. So first is safety. We want to make sure that CRNAs working in this environment are safe. We want to make sure that there's adequate personal protective equipment, that there's adequate testing, and that we're doing everything to ensure that those who are serving on the front lines in this crisis do so with the equipment necessary. So we're pushing for additional funding for personal protective equipment, additional ramp up in the capabilities for testing, and all the while continuing to work to make sure that it's a safe environment as possible for every CRNA who is going to work to provide care. We also, we've talked about elective surgeries coming back online, and we want to make sure that it's done in a way that's safe for our members, those who are going to be providing anesthetics for those elective surgeries. So we're working hard with members of Congress to provide some safeties and some safeguards for those CRNAs who make the determination that the facility or the state is not ready, that it's not a safe environment. We want to make sure that there's protections for their jobs, that if they conscientiously object to returning to work and providing care during these elective surgeries, that they will not be terminated due to that fact. So we're working hard on that front. We're putting the safety of our members front and center in the minds of legislators here in Capitol Hill and with the administration. The second bucket is financial security. We want to make sure that we are taking steps for that very large percentage of CRNAs who employment has been adversely affected, either through unemployment or underemployment. So we're working very hard to provide some direct funding availability for healthcare providers, including CRNAs. We're working hard on a legislative proposal that would create a grant program specifically for healthcare providers. And in that program, we're working with a couple members of Congress that have introduced legislation that included the grants, but capitated the annual salary at $75,000. We've been in close contact with the introducers of that bill to say that that's just not adequate for many healthcare providers, including CRNAs, to remain financially whole during this crisis. So we're pushing and we're getting close to finalizing a number closer to 90% of practitioners' annual salary at the time at which their employment was disrupted. So that's a major push that we're focused on the financial security end of things. And then again, full practice. You know, we're always looking for the opportunity to make the temporary removal of supervision permanent. So we're working closely with a number of different stakeholders to lay the foundation for that to happen. You know, when this elective, when the emergency declaration is lifted, we want to make sure that we can continue to work without unnecessary barriers to full practice, because we're going to need all the capacity to the highest quality care that the healthcare system can muster, and we think that permanent removal of supervision is going to be a key part of that. So next COVID package is coming. We're working hard on a number of different fronts and engaging a number of different stakeholders, and I think that's important to note. Along with the National Rural Health Association, we have stood up a coalition whose first meeting was today. It's the Rural Health Action Alliance. It was over 20 organizations on the initial call, and we started to work on the agenda kind of that we just talked about, to make sure that we're partnering with the right people to be as influential as possible in the ability to advance our interests. And that ties directly into you know, our support of rural healthcare. You know, Randy talked a little bit about it earlier, and rural healthcare in America is in dire straits. And there hasn't been a collective voice around rural health issues here in DC for quite some time. And we saw this as a perfect opportunity to coalesce around this issue and bring some, you know, influential and integral other associations together to start advocating for rural health, because it is rural healthcare. The rural healthcare delivery system is in dire straits, and without congressional action, we are going to see closures of rural facilities and potentially the death of rural healthcare in America. You know, and that's frightening. So we want to make sure that we're proactively working to keep rural facilities open and operating. You know, we predominate in rural America, and every American should have access to care. And you know, so we're working really hard to make sure that we're supporting those rural facilities that provide that care.
So Ralph, that was extremely helpful, but there was one thing you didn't talk about. What about the VA? Can you give us an update on what's going on there?
Yeah, and thank you, Dr. Jordan. The VA, you know, and the care for our veterans is always front and center with this association, and it makes me proud to work here. And we continue to work to get full practice authority within the Department of Veterans Affairs for certified registered nurse anesthetists. We believe it is critical, a critical step to improving access for veterans that have earned the right to get timely access to care. So recently, there was a directive released internally in the VA that was specifically aimed at formalizing the VA's authority to have state license carry across state lines. So there would be no, the ability of providers to work across state lines, to move around the VA facilities, to work via telehealth, would be unencumbered by any disparities in state laws and regulations. We thought this was a good step forward, and we were very supportive of an associated memorandum from the chief executive in charge, Dr. Stone, that urged facilities and veterans integrated service networks to change bylaws, change policies to recognize the full practice authority of CRNAs during this current COVID crisis. Our colleagues from the American Society of Anesthesiology did not like this decision and have been actively engaging to stop this from being implemented and to stop any possibility of this full practice authority to be made permanent. They've had thousands of their members and I guess friends and families weigh in with Congress to have their members of Congress weigh in with the VA to say, hey, this is not the right policy. This policy will put veterans in jeopardy. We know that's not true. And we are working hard with members of Congress. We've gotten several letters into the VA supporting this proposal and supporting it being made permanent. And we have engaged our grassroots network, and we have had almost, as of today, nearly 9,000 actions taken. And this is the first time that we've added a feature to our grassroots advocacy. Through our one of our platforms, we're now enabled to engage with our friends and family and other folks who are interested in weighing in. And we've seen to great success. So it's a public-facing option for folks to weigh in, and we've had over 5,000 actions taken on that end as well. So we're doing a lot of work to make sure that the VA feels supported in their decision to move forward with full practice on a temporary basis. But we need to make sure they understand that it is the right policy during a crisis. It's the right policy after this crisis. And it's what they need to do to ensure that they are providing the most cost-effective, highest quality, most timely access to care for our veterans across the country. So thank you.
So we've heard a lot about practice, about state government affairs and federal government affairs, but we really haven't broached probably one of the most concerning topics of all, and that's CRNAs and their mental health as we move through this crisis. And so I thought it'd be helpful to have Julie Rice, Manager of Health and Wellness, join us today and kind of address some of the common questions that we're hearing from our members to be able to enlighten us and maybe help you as you move through these days that are very difficult at times. So Julie, the first question I want to ask you is, what's new in support for the well-being of CRNAs and SRNAs?
Thank you. We're producing a variety of CRNA and SRNA produced COVID-19 well-being resources. Watch for these from multiple directions: Facebook Live, podcasts, webinars, articles, and videos. You'll find information on all of these, plus a plethora of resources specific to nursing or healthcare and specific to this pandemic housed on our website among the COVID resources in the well-being category. During stressful times, likely due to lack of time or access or just seeking comfort, we tend to fall into unhealthy habits and behaviors. Please make it a priority to practice self-care. Each day, as much as you can, eat nutritious foods, move your body, try to get enough sleep, connect with family, friends, or coworkers, and take a few moments of deep breathing or meditation. These and many more help you reduce stress, restore energy, find balance, and support your immune system. An infographic on these and other ways to reduce stress is posted to the webpage, which I think we all already know about these tips, but it's always a good reminder. Addressing all of the overwhelming emotions and stress related to COVID-19 is necessary for mental well-being, as you mentioned. AANA has partnered with Parkdale Center for Professionals in their Support the Front program to bring opportunities to share stories and find free virtual peer support for all healthcare professionals on a variety of topics like stress, fear, burnout, grief, anxiety, and exposure concerns. Also supports for the family, self-care, and addiction recovery support. Again, you'll find all of this online with the COVID resources, which are updated almost daily. If you don't find what you need, please email us at wellness@aana.com.
So, Julie, there's a lot in the news about addiction and the addiction crisis as it relates to the pandemic. What does the AANA have to offer to our members?
You know, as we've mentioned, there are multiple crises within this pandemic, and I think one of them is this is definitely a risky time for substance use disorder in a variety of ways. Stress and isolation, as well as an overwhelming workload or underemployment, can be an impetus for social drinkers to overuse alcohol or other drugs. Indications are retail alcohol sales are up, depending on the source, 300 to 800%. For individuals in active substance use disorder, lack of access to alcohol or opioids can force abstinence and trigger potentially life-threatening withdrawal. For individuals in addiction recovery, this is a perfect storm for threats to sobriety. The stressors in isolation, changes in work or in treatment aftercare, and lack of in-person support meetings are some examples. A reminder, if you have alcohol or other drug concerns, either for yourself or a CRNA, SRNA colleague, The AANA helpline is available 24/7 for live confidential support and resources. From the aana.com/COVID wellness page, you'll find more information under this topic of alcohol and other drugs and recovery resources.
Julie, I know we've been very busy in the mental health arena, but is AANA collaborating with other organizations? And if so, what type of activities are you engaging in? Is AANA engaging in with other organizations?
So coronavirus is taking a toll on everyone's mental health. I don't think anybody's going to be unscathed at the end of this, as each of you are aware. But CRNAs and other nursing on the front line are hit especially hard. In addition to the Support the Front partnership, the AANA has created a coalition of nursing groups along with the American Psychological Association to share resources with a goal to bring attention to these needs as well as access and availability of mental health supports. One part of this is an advocacy letter from the collective voice of nursing on the urgency and a call to action for psychological first aid. So we're currently working on that and holding online meetings to try and get this letter started and out to the right parties.
So I want to, first of all, say thank you to all of our panelists, Bret, Aana, Ralph, and Julie, and Randy, for taking the time to be able to discuss some of the common themes and questions we are now receiving from our members. We are repeating our past survey of CRNAs seeking information about your current employment and clinical challenges. That survey will go out March 5th. I'd like you to please keep an eye on your email and please take the time to answer that survey. It really helps us understand what's happening out in the clinical area. Thank you very much for allowing us to address you. And I'm going to go ahead and just turn this over now to Kate and ask Kate to go ahead and wrap up this particular town hall.
Thank you, Lorraine. I think you meant May 5th on that survey.
I did May 5th. Thank you.
Sure. Yeah, and I'm looking forward to it. That'll be interesting to see how the data has changed. To all of you, thank you for joining us for this presentation. I know many of you are experiencing unique situations which we have never seen before. So many of you on the front lines have contributed in such a meaningful way. We cannot thank you enough. We've seen many changes of we've seen many images of our own giving themselves to make others' lives better. If you're willing to share your stories with AANA, please do. We're increasingly finding ways to share those in the media. CRNAs are doing outstanding work every day during this crisis. I invite you to email your stories to pr@aana.com. On behalf of the AANA Board of Directors and staff, we are profoundly grateful for the sacrifice you're making on the front lines during this pandemic. It's because of you that we're able to combat this vicious virus and save lives. Our thanks go out to those of you who have experienced abrupt changes in reimbursement and job security. We're just now seeing a reopening in some markets and will need to remain vigilant as we safely care for patients. Thank you for your support of the association and for your membership. This is a difficult time for all of us, but we're getting through this together, and together we have the strength to come out stronger on the other side. Thank you for joining us.